I've gotten a lot of comments lately about my experience with the side effects of using naltrexone for alcohol use disorder. So in this video, I wanted to show you what the research showed with regards to side effects. I'll share my personal experience with side effects, and I'll also share a poll that I took of individuals who are using the method and their personal experience with that side effects. Nothing in this video is medical advice. It's just for informational and educational purposes only. I'm going to be pulling information about the side effects of naltrexone from this research paper here. So it says that most of the adverse events occurring early in treatment with naltrexone are gastrointestinal, including nausea, vomiting, and abdominal pain or discomfort. These side effects, along with headache and fatigue, made up the majority of reports in clinical trials. Such effects, usually mild in intensity, occurred in up to 30% of patients. It goes on to say that most side effects are mild and self-limiting and usually occur only during the initial therapy. It also says that the typical starting dose of naltrexone is 25 milligrams for several days, with a subsequent increase to 50 milligrams per day over approximately 1 week. The drug should be taken after a meal, since nausea and vomiting are more likely to occur if the drug is taken while fasting. In my personal experience with the medication, I was really lucky because I worked with a physician who was really knowledgeable about this medication. And so she told me to start it at the 25 milligram tablet dose. I did that for a few days. She also advised me to take it with a full meal and water. My side effects were pretty mild in the beginning. The ones I noticed most obviously were I was really tired and sleepy and kind of out of it. And my stomach was a little upset. It wasn't nauseous. It was just kind of like upset, kind of grumbly a little bit. Those side effects, I really only noticed them in a big way the first couple times I took the medication, but then the longer I was on the treatment, the side effects completely went away, to a point where after a little while I would have to write a note to remind myself that I took the medication, simply because there were no side effects. I also did this poll a while back where I asked people what their experience was with side effects on naltrexone, and out of 65 people, 28% didn't have any side effects, 42% had some, but they were mild, and another 15% said they had them, but they went away, and then 15% said they had side effects and they never went away. I've been a recovery coach in this field for about 5 years now, working with people who are on naltrexone following the Sinclair Method, and I would say that that's about accurate with what I've seen in our program as well, where some people might have side effects in the beginning that are mild, but they typically go away. And I've had clients, even if they had side effects in the beginning that were causing them to be really nauseous or throw up, they adjusted to the medication over time, working with their doctor on the dosing, and the side effects did go away. So for most people, of what I've observed in my personal experience, and as we've seen through the research, if they have side effects, they happen in the beginning, but typically they do go away with time. And like the research paper said, the medication being taken with food can help as well. So I hope this answers your question. As always, if you want to learn more about the Sinclair Method or get started on this treatment, check out the link in our profile where we have a private online program that can guide you through the protocol step by step. Bye for now.